Good afternoon and welcome to Bariatric Friday. My name is Kemal Erkan. So this is another episode of Bariatric Friday with Dr. Isaias Irgau, who's joining me right now. Dr. Irgau, how are you doing?
I'm doing great. Come on. Great to
So,
be back on another Bariatric Friday on this snowy day.
right, so it's a lot of snow out there. I was just telling you earlier, people should be careful. A lot of people, they think that this is a lot of snow, but it's really not. The roads are clear. It's just like people need to be uh, kind of keeping their foot from the brake because that's what gets them in trouble. So our event is focusing on knowledge and expertise in morbid obesity and overall obesity. So our goal is to discuss different issues related to morbid obesity, but mainly those patients who are going through the process. That's our main goal. But we also we know that a lot of people who are not going through the surgery, they're also dealing with the obesity, and we want to be a good, reliable source for them so they can always watch and listen to what we have to say. Interesting thing, Dr. Gal, my family, sometimes they forgot what I do. And after doing all these sessions, they send me videos related to our topics, like the intermittent fasting. It's going to be one. So I'm like, do you guys know that we do these every week, right? So that's why we kind of keep trying. Um, Yesterday, one of our doctors, Dr. Chris Savage, who's part of our weekly meetings, he's like, well, I can't figure this YouTube thing out. And then I check his phone and he didn't have the application on. So, then he's a little bit on the mature side. I'm not going to call him older. So that's why what I realized is that we have to talk about these things on a regular basis because it's never ending. So what I would like us to do, Dr. Guy, if you don't mind, I want to start with our new set of survey questions. And this is our question number 4. So I'm going to bring this to the screen so you can also see. And, again, the goal is to make sure that people also communicate with us. And then there's also one other person who left a comment for one of our other intermittent fasting discussions. So I do want to ask you that before we go into the actual topic itself. Mm-hmm. So the question number 4 in this series is related to where they get their information and people getting their information, 40% from their healthcare professionals, and 40% is from online researchers, and about 20% they get from friends and families. So this is important because we want, of course, the online research is good, online search is good, but healthcare professionals should be the main source of where we are getting our information. But also this is kind of helping us to better understand why we are doing what we do today is because people are doing a lot of online researches. So then they can actually get reliable, proper, accurate information from us. Anything you wanted to say on this one, Dr. Gal?
No, I mean, that's the point is well taken. Obviously, healthcare information is information, and people will usually gravitate towards getting information of healthcare from whatever they get information from other things as well, in general, right? So with the preponderance of online availability of information, it is expected that people will go there as well. But, the advantage is easy availability of that information. The caveat is reliability of that information. That is valid for any type of information, of course, right? But it is even more important for healthcare-related information because that has impact on the people's health if they take action based on the information they get. So the safest way for people to get information would be to get that from an expert, somebody that has been certified by society to have enough knowledge about that topic, right? And it is no accident that people have to go through a lot of years of schooling before they become healthcare professionals, because you need that kind of rigorous knowledge before you can really guide people about their health. So, and we have enough healthcare professionals for people to be able to get to. Having said that, it doesn't hurt, for people to obviously try to broaden their spectrum as well. But taking action about your own health, you want to be guided by a health professional, clearly.
So our next question, number 5, is what expectations or hopes for the outcome of your bariatric surgery? There are 202 answers, and of course, the significant weight loss is number 1 with 37.6. Improved health condition is 24% 3. Better quality of life is 23% 3, and better look is about 15%. So my understanding from this is that, of course, people do want to lose weight, but then they really want to improve overall their well-being. Anything you would like to add? And we're going to discuss these in a different session with all surveys together.
Yeah, I mean, these are very kind of interrelated answers to some extent. It would be unusual to have somebody just focused on the weight loss per se without really understanding the implications to their health. And it would be unrealistic to expect somebody to be doing this just for health reasons, really not looking at the advantages of, the actual weight loss as well, right? But focus is focus as well, right? So the main thing that people see on the outside is the weight itself, and that's a burden, right? That's a burden, and add to that the stigma that society has placed on people who are overweight. So getting rid of that outward look with the excess weight becomes a very important goal for people, right? But as we are, advancing in our knowledge of obesity, and as the health implications of obesity are penetrating the society more and more, it's very gratifying to see many people now talking about obesity from a health point of view as well, right? And I see that in practice when I see patients, Kemal, that may have been struggling with obesity for 20, 25, 30 years, not necessarily accepting it, but trying to deal with it in the traditional ways, right? But then they come at one point to realize that bariatric surgery is the most effective solution. And that point usually comes really with the realization that obesity is affecting their health as well, whether it's diabetes, whether it's high blood pressure, or sleep apnea. And then they say, look, yeah, definitely, then I'm going to go through the surgery, because it's not just about me looking thinner, it's also about me being healthier and living longer.
And our next question, number 6, is what challenges they have faced currently pre-bariatric surgery phase. So 30% says emotional struggles, 28% says lifestyle changes, 22% says insurance-related issues, which is surprising actually, and then 20% is dietary restrictions. So now this was kind of, again, with the insurance-related, I wasn't expecting that number to be high. There's about 180 votes on this total, and then 22% would be about 36. We know that almost any major insurance, including Medicaid and all the Medicare, Medicaid managed cares, they are actually covering this. There may be deductibles and co-insurances, of course, but 97%, these are well-covered services. But as we can see, lifestyle changes and emotional struggles, that part is not surprising, right, Dr.
Yeah, no, that's not surprising at all. I mean, but also the insurance issue, Kemal, the way I look at it is that, yes, we do have a much better coverage situation now than we did 15 years ago, 20 years ago. And it was really a battle to get insurance companies to understand the really advantages and importance of bariatric surgery. But also, insurance companies don't make it necessarily easy and transparent for people to really proceed with bariatric surgery in many ways, right? So this perception that this is something that insurance companies are going to deny, you see it prevalent among people. And that's the first thing very often people will ask is, will my insurance cover this, right? They don't ask that about going to the emergency room to get, a broken foot fixed or something like that, right? But they ask about bariatric surgery again, because there is this perception that this is not a healthcare issue, right? And that perception, unfortunately, persists throughout society, but also insurance companies are not doing really the best they can to make sure people are aware of the availability of this, right? And still, also, there are extreme situations, Kamal, and you and I look at these, from time to time in our case conferences, where there are certain insurers that outright exclude bariatric surgery coverage. There's, this nice gentleman, right, that we've been working with, that he works in the healthcare arena himself, right? And yet his insurance company actually excludes bariatric surgery coverage. It is mind-boggling.
No, that's correct. So, all right, now we are gonna discuss intermittent fasting. So we discussed it several times in the past. Well, I think we reach out to more people with this topic, because not just those who are going through the bariatric surgery listening this, but others are also listening because many people are doing this. We want to discuss the intermittent fasting with how it's being utilized in the bariatric surgery process. And also, we can actually answer some of the generic questions that we may have from different people. Now, how do we utilize intermittent fasting in our process?
So, I mean, let's define it first, right? As you said, we've talked about it in the past. So, what is intermittent fasting? So, as the wording, describes it, it is fasting in an intermittent fashion, right? So, you are fasting certain periods of your day or your week, essentially, right? And that fasting essentially means total abstinence from calorie intake, right? But that does not include water and calorie-free drinks, essentially. So we do want to emphasize that we're not talking about dry fasting here. We're talking about water-only fasting, where you are really, when you're fasting, you're actually drinking water. Not only is allowed, but obviously it's very important that people know that drinking water is important, and we'll come to the explanation of why this is important maybe later on. So how can you do intermittent fasting? Well, you can, for instance, decide that within a certain period of your waking hours during the day, you are going to eat no food at all, right? And that could be maybe 16 hours out of the 24 hours, in which case you will have a window of 8 hours in which you will be able to eat, and the 16 hours you don't. It could be 12-12, it could be 18-6. These are hours of the day in which you're fasting, and then the window in which you are allowing yourself to eat. So this is one way of doing intermittent fasting. Another way of doing intermittent fasting that has been popularized would be to really look at days of the week. For instance, you could be eating normally 5 days out of the week, and then 2 days you would be fasting. Like it would be like complete fasting, where you really don't have much to eat for about 48 hours out of those 7 days, essentially. So that's another way of doing it. So, but the basic tenet here is that, come on, the basic tenet, and that's why I'm so much a fan of this concept, is that you are taking a break from eating, right? Now, this is very important in my view, especially in societies like ours, right? Where food availability is so prevalent that you cannot turn your eye one way without really facing an image of food in front of you, whether it's sitting on your table or it's on your screen, right? So food is very, very prevalent. And if we didn't have a sense of control, Kamal, we could be munching all day long. And the only time we would be stopping eating would be when we are asleep. Well, in reality, this is not too far from what is happening. And in part, the reason we're struggling with obesity is that prevalence, that availability of food, that associated with the biology that we have inherited from our ancestors, which is a biology that is driven to conserve energy and therefore to favor obesity. No wonder we have an epidemic in our hands. It didn't take, more than a few decades for this to explode. And now look at the United States. Come on, there is hardly any state where the rate of obesity hasn't reached 30%. This is incredible. And yet, along that, you also see an increased prevalence of type 2 diabetes, right? So in a society like this, one of the things we could do is ask ourselves, okay, I'm going to take a break. Take a break for 1 hour, take a break for 2 hours, take a break for 6 hours of the day where you just drink water so that you have a scheduled approach you're eating. And that's why, in general, Kamal, I like intermittent fasting. And I know you're a big fan of this as well, in several years that we've been doing this. So taking a break from eating, that's the biggest message that I think intermittent fasting does, right? Now,
Well,
what it does, do you want to say something? Go ahead.
well, I think it's a discipline, number one, and discipline, we use it in a positive way, not in a negative way. Discipline is something that that we are capable of doing on a schedule. Now, of course, we all have our own weaknesses, and but one thing that's really important, and what this intermittent fasting is doing for us, is it's helping us to kind of better keep a better record of what we do, because the time that we actually eat is limited. So I do want to share my own journey for this year. And then I started actually sharing this last time with Beth, one of our dietitians.
Yeah.
So let me see, Dr. Ergau, tell me if you are able to see this.
Yeah, I can.
So I added something to this because I was cheating, of course. So this is 18 days of January. So as you can see, most of the weekdays, Monday through Friday, I do about 16.5-hour fasting. So, but then this dessert part of it is where I was actually getting a lot of kind of maybe unnecessary cheating, and that happens during my eating time. So I said, okay, well, let me see what I do with ice cream or milkshake issues. So now, as you can see, out of the 18 days, there are 5 days that I cheated, right? So 1, 2, 3, no, 4 days.
4 days, yeah.
4 days. So, and I do want to actually tell you what something kind of funny happened. Last Friday, we were going for one of the events, and then in the afternoon, they got me milkshake. Then I didn't drink it, but I left it there so then Anne would know, so that I didn't drink, because I have to be honest, because that night I had ice cream. So, but this is what it takes. So like I'm entering these on a daily basis or every other, but in order for us to have a good outcome, we really need to see clearly, are we really doing what we think we are doing? And this is helping. So I tell everyone to get some kind of diet journey, so that you can keep your activities, your eating habits, so that it will give you a really good idea. And the other thing is, of course, we always discuss, without the exercise, with this diet, things don't happen. Even though, like yesterday, as you know, it's a slow day, I still have my 5,000 steps. I had to put extra effort to do that, because like I wasn't able to walk the way that I normally do. So the idea again is having this type of diet, if it works for you, and then you can make adjustments. So you and I, we do Monday through Friday, and then we are off on the weekends. But we don't go crazy on the weekends either. So because the issue of, I think maybe our stomach kind of now knows what it is, so it can't really handle eating too much. So, and with the exercise, I think we are able to get the best outcome. So almost every patient we review in our accountable care case conference: hypertension, hyperlipidemia, diabetes. Number one issue we cover, the two big issues that we cover is diet and exercise. And this is not like starving yourself, but this is just like doing it in the right way so that you have a good record of what you are doing, and also regular exercises, which we discussed this before. It doesn't have to be like you are at a gym killing yourself. You can just take 15-20 minutes walks, jogging a couple times a day, which is easily doable. So now, I guess from once we have this background, Dr. Irgau, you actually start using this in our program for our patients, because our patients also, they have to get some weight loss prior to surgery. There's a robot diet that they have to do 2 weeks before. How do we utilize it in the program if we can kind of help our patients? And then my next question is going to be, someone who just had weight loss surgery, how quickly, this is a question that I have from our channel from YouTube, how quickly they can actually start doing intermittent fasting after their post-surgery?
Absolutely. So, I do want to emphasize the word discipline. I came across a quote from Abraham Lincoln about discipline, and he said, discipline is choosing between what you want now and what you want most. Isn't that a great quote? So that's essentially it, right? And having those breaks, having that time off eating, letting yourself know that you are not open to business in terms of eating within a certain frame of the day. That is the structure that we want with intermittent fasting. When it comes to bariatric surgery, I think it's actually well adapted to bariatric surgery, right? I mean, a lot of people worry about the fact that patients are not going to be able to eat those, small meals frequently and so forth. Well, actually, one of the struggles I see long-term with bariatric patients is when they start grazing, that is, eating too frequently. They can eat only small amounts, but if they're eating too frequently, then that can add up, and then weight regain and other struggles can come up, right? So having a structure in which they say to themselves, okay, I wake up, I am not going to have anything to eat until this time. Or I wake up, I'm going to have my breakfast, but then I'm not going to eat anything until that time. So taking that break, taking that fasting, number of hours, that's the structure that we want. Now, why does this work really well with bariatric patients? It's because they cannot binge when it's time for them to eat, right? Because they have a small stomach. Sometimes intermittent fasting doesn't work for some people because they fast all day, then they have a huge meal and an ongoing meal within the 2-3 hours in which they have to eat. You don't want to do that. So if you're a bariatric patient, you don't have a capacity to do that. So it's well adapted for our patients. So in my view, before surgery, I talk to patients about this option because I want to introduce this structure in their way of looking at eating, right? So the food is available all day long and everywhere, but we're not available to eat it all the time either, right? We have our own time. And that is the thinking that intermittent fasting can bring. Now, in terms of when it is, introduced after bariatric surgery, certainly after the weight loss has stabilized. We do not want intermittent fasting when patients are actively losing weight. So we're talking about a year and a half, maybe 2 years after weight loss surgery, once we are in the maintenance phase. So this is not something that we're going to introduce anytime soon after bariatric surgery. And the reason for that is that people are actually losing weight actively, and they need to have important nutrients, including protein and micronutrients, at a reasonable rate. So we do not want to restrict them at that time. So I talk to patients about intermittent fasting after bariatric surgery only for long-term maintenance. And this comes up as an issue really when I see patients struggling to keep the weight off, or they've come back to me after they've regained some weight. So we talk about this option, essentially. I do want to go back and explain again the thinking about intermittent fasting. So as it is, we do practice intermittent fasting in our daily life, even without thinking about it. And why is that? Well, because we do take a break when we go to sleep. When we go to sleep, we are breathing, but we are not taking anything else. Most of us sleep through the night, and at that time, you're not eating anything, essentially. So that time is actually when our body is fasting. And, we don't know exactly still why we sleep, but we know that sleep has enormous benefits to our health, right? And one of the benefits really is that our body has time to really recuperate without having to worry about processing food that is coming in, because none is coming in at that time, right? So we practice intermittent fasting because we take a break when we sleep. And what we're saying is, let's extend that. Let's add more hours of fasting in our waking hours. Now that could be 6 hours. So if you sleep 6 hours and you add another 6 hours of fasting during the day, already you are at 12 hours in which you're fasting, right? 12 hours and then 12 hours of window. If you're adding 8 hours, of fasting to your day and you sleep 6 hours, now already you have 14 hours and so forth, right? So you can introduce whatever works for that person, essentially. But the important thing is that they are taking a break. So, for instance, if I'm doing intermittent fasting so that I don't eat, the whole day, morning, and I start eating only at 2 p.m., it means that at 10 a.m., if I'm sitting at work with other people and somebody brings some donuts or some food, I know I can't eat. Why? Because my schedule says this is locked. Yeah, we're not. Right? So what better way to really structure yourself than having that kind of attitude? Then the opportunity for failing, the opportunity for being sabotaged is much less, essentially, if we have this. So that's why I do like it. Now,
Sabotage is the right thing, right word there. So it's people sabotage what we try to do.
right. I mean, people mean well when they're offering our food. Offering food is one
I
of
don't
the
think
best ways to really to tell somebody that you really like them, right? You offer them food. And one of the best ways to feel, to tell somebody that, you like them is also to accept food for them. That's culturally, that's the truth in many, many settings. But when we have food availability to the extent we have it in this country, Kamal, that is hurting us. That's why we want this type of structure to happen. So at a physiological level, what happens when we're not eating? Well, there is good evidence that improves our metabolic health. It improves our insulin sensitivity. It leads to better sugar control. And in some very interesting ways, it actually improves our energy, our concentration level. And many people say that, they used to nap a lot during the day. Now that they're doing intermittent fasting, they don't have to do that. They feel more focused in what they're doing. So there are certainly a lot of benefits. And then, although they have not been proven in human studies, there are really very appealing possibilities that this could also lead to long-term health and extended, life expectancy as well. In
That's the
terms,
origin of this actually
absolutely,
testing,
absolutely,
because they
yeah,
didn't do their initial goal to kind of show the intermittent fasting is slowing down aging. But then they see another benefit of it is the weight loss,
absolutely.
which makes a lot of sense. So that's actually that is the origin of the intermittent fasting. So I think there's a lot of issues around the way that we eat, and there are a lot of issues with people around us, including our family members. So because if you talk to family members, when you tell them you are doing intermittent fasting, uh, first reaction usually is negative. So especially if your mom is from Turkey, Greece, Italy, Spain, Mexico, um, Ethiopia, Tigray, any of those countries. I wish my mom was from Finland so that I didn't have to worry about it. But So the whole issue is eat, 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 eat. Like, well, eating is not the solution, right? So we kind of need to figure out that problem. We need to kind of solve that issue that you don't have to eat and you don't have to keep eating. You don't have to please people with food. Those are kind of issues that we have. But what I like about this, it kind of gives me a good framework so that, okay, so I'm free to do whatever I need to do in this time frame, but then I'm off, I'm closed for business for 16 hours, Monday through Friday. And you see the results slowly, but definitely you see the results. But again, having a good record keeping is the key, in my opinion, Dr. Irgau, because many of us, we lie to ourselves, including myself. You know, if maybe someone didn't see the milkshake, I was going to finish it last Friday and then still have the ice cream because that's what I want to do. But once I need to report that, and then that report is available to someone who saw what I was eating that day, so then I need to make sure that you know, I have a good record, honest, clear record keeping, and also again, the fitness is something that is the most important part. Now, I remember when we started doing this the first time, it helped me personally. It helped me to know that you were doing it on the same day. And then I remember actually giving you a call, or you called me, one of us did, to see how we were doing sometime in the afternoon. And that probably helps a lot for those who want to start and not able to do it on their own. Find someone who is able to support you. And now in my office, actually here, I know at least 4 or 5 different people that are actually doing
That's
doing
great.
the fasting, which
That's
is
great.
great.
Yeah.
So I think it would be great if people actually talk to their friends and families to see if they can get one other person to do it with them. And then it got much easier. In fact, now, like this morning, for example, like I stopped eating last night around like 8. Didn't have anything after 8. So in the morning I had lemon juice with warm water, and then I had coffee. So then I got here and I had pizza. So of course, I'm not proud of the pizza part, but I feel so good about 16 and a half hour no food, but just water and coffee. So then that doesn't bother me as much. Like if I eat
Absolutely.
that.
No.
So and it makes it a lot simpler, honestly. Like number
It
of
does.
times you go to the
Does.
bathroom, number of times you have to do other things, and you know how tired we get when we eat. And you would know in any of our business meetings, I would never eat before the meeting and during the meeting. And main reason for that is because I get tired when I eat.
Yes. Yes. That's a
So,
good point.
right, so that means our
Yeah.
bodies start working, and then if I have a primary focus that time, now my body is not with me on my primary focus with business, so it's actually doing its other stuff,
Right. Right.
right? So it makes things much slower. So I don't know. I feel like this is a good way to handle the weight loss and also the aging. So
Yeah. No
and also
question.
it's good that I don't have any kids, so that also helps too.
That is true. That is true. Yeah. One issue we should mention definitely is the importance of drinking water, right?
Mhm.
Because when you're doing intermittent fasting, absolutely, you know, the proportion of water that one would be getting from the food is not there anymore, right? So it's important to make sure that that is replaced. But another reason why the water also is important is because very often we mistake, you know, thirst for hunger, right? We think we're hungry, but really what is happening is we're thirsty. And because the reason for drinking, you know, because you're thirsty, or eating because you're hungry, are intermingled now. They're lost in our mind because of the way we have everything so clearly and easily available everywhere and anytime. We may not know. We may not know really when we are thirsty or hungry. So when you're doing intermittent fasting, if you do feel, a bit of hunger pang, it's a good idea to just drink water and see what happens. And it is possible that that was the case and it will go away. Now, there are certain situations, that are important to emphasize when intermittent fasting has to be tempered, right, or really supervised well. People with chronic diseases like, diabetes, high blood pressure, people who are taking different medications, it's important that they have a supervision from a healthcare professional, their physician, before they engage in this, so that they can have important advice. For instance, if one is taking medications for diabetes and they don't eat for a prolonged period of time, their blood sugar can drop too low, leading to a difficult situation. So it's applicable to the vast majority of people who don't have major, health problems. But if they do, then it's important that that is done in a supervised fashion. Certainly, women who are,
Definitely.
pregnant, and in situations like that, it's important for them to really, like in any situation where you're engaging in a different way of eating habit to try to control weight. Especially if you have medical problems, it's important to seek advice from your doctor before engaging in it. Going back to what you were saying about getting an information online versus your own doctor will know your own individual situation. So having their blessing for this is important.
That's very important, so that we actually we don't make these decisions on our own. So when I started, obviously, I started with you. You are a healthcare expert, but on the morbid obesity, you are the person, you are the name. So, like, I did it in the right way. We discussed these in our provider physician meetings as well. So then, because some of them are new and we need to bring ourselves up to date with what's happening outside of our world. So that's why I don't mind if people do their online search and go to their primary care or a dietitian and have good educated questions. Get your tests done and then understand where you are, and also do another follow-up test to see how this is affecting where you are. Take your daily vitamins. That's not just for patients who are going through the surgery, but those just anyone, they should be taking their vitamins. So this is definitely not something that people should be doing on their own. But it's once you do it, I know people are going to love it. So, all right, Dr. Khan, well, that's all we have for today. I know we are going to have other weekly sessions. I believe next week they're on. This was our second episode of this new cycle. When I cover these things in different ways, questions are always helpful. Survey on the X platform is always now kind of helping us with understanding certain things, and there's also some engagements there, which is really encouraging. So we'll be back next week with another topic. And outside right now, it's a lot of snow there. Please drive safe. And then we'll see you soon. Bye-bye.
See you. Bye-bye.